So this video is going to be a tips and tricks on some of the difficulties that you might be running into in inserting your NG tubes. This is not a complete insertion video. I will try to do that one at a later time, but for now I just wanted to give you guys a tips and tricks that may be helpful in helping you be successful in inserting your NG tubes and alleviating some of the difficulties that you've been running into. The number one absolute most important tip that I can give to anyone is to clearly communicate to your patient what you're doing as you are doing it, and give them lots of time to process that information. An NG tube insertion does not have to be a rapid race. It can be done slowly and should be done strategically, and it should be done in stages. And I'm going to demonstrate what I mean by that. So one of the other major tips that I can give is utilize a whole lot of lubrication on your NG tube. I have utilized the Muco jelly that we utilize for catheter insertions, as it has xylocaine in it, as a substitute to regular Muco if you feel that a patient may not tolerate things very well. I caution people to at least check in with the physician regarding this procedure, as xylocaine should be prescribed, but it will alleviate some of the difficulty that you're running into with your patient. So I strongly recommend obtaining that piece if you think of it, and it may be helpful for everybody involved. Now, I have in front of you a cross-sectional diagram of the anatomy of the human head. And this is the piece I think that most people have a difficult time with. So if I approach this head going upward into the nair with my NG tube, you'll notice that the end of this NG tube is going nowhere near where I want it to. It's not going to go down the nasopharyngeal pathway and into the esophagus. It's going to get jammed up in the posterior of that sinus cavity and cause discomfort and pain. So one of the biggest tips that you can provide is you grab the tip of the nose and you push it upwards so that the nares are now facing you directly. This allows for you to go in at a 90-degree angle to the face, and even sometimes if you can achieve a downward trajectory, that is ideal. So the very first step, and I will tell my patient this, so the first thing we're going to do is I'm going to insert this and try to get it to the back of your throat. And we'll stop there and we'll regroup, okay? So I will insert the NG tube, and normally once you reach this point, there's a bit of resistance. I find sometimes if you turn the tube, if you twist it this way with your fingers, or you try to go upwards a little bit, you try to give yourself a bit of an upward trajectory again, and just gently sort of press forward, you'll feel it give and head in the right direction. Once you have achieved that, at that point, it is appropriate to stop and check in with your patient. Are you okay? Is this going all right? You're doing awesome. We're almost there. That was the hardest part. Once you've relaxed your patient and you've confirmed with them that they're ready to proceed to the next step, this is where I oftentimes will describe to a patient to think of if they have mucus running down their throat, or if they're trying to swallow something, a phlegm or whatever in the back of their throat. When they feel something in the back of the throat there, that they should try to grab at it and swallow it when they want to. Some patients can utilize a cup of water to do this. I caution with the cup of water, don't have people just chug water, as they're very likely to aspirate that water if you go too fast and they're not understanding what's happening. Another good positive tip is when the patient's head tilts back, which is an automatic reaction to having this procedure done, it really sort of closes off the angle that you're trying to get to. So if the patient brings their chin forward a little bit, so you have them bring their chin to their chest as much as possible, what that'll do is it'll actually block away your airway here, and it'll force the tube, once it gets to this point, it'll force it automatically to go down the esophagus and not the trachea. So that's another tip, is to bring the chin down to the chest and say that to the patient. You're going to do all of this before you start advancing beyond this first step. So the next step will be, okay, so I'm now going to move the tube forward, and I want you to feel for it. If you choose that water is a good plan, then say, once you feel that you want to swallow it with a sip of water, just a sip. And you get the patient to swallow a sip of water and see if they can get the tube down. Once you've gotten down a good 5 to 10 centimeters from the nose, you are probably exactly in the right pathway that you want to be. At this point, again, I recommend stopping and checking in with your patient. How does it feel? Are you okay? If you notice that your patient is gagging and not tolerating things as well, but they're not choking, at this point, you may choose to go a little quicker if you're confident that you're going down the esophagus and get to the point, esophagus, and get to the point where you have determined the depth of your insertion. And then that should be a helpful way to get your NG tubes inserted. I cannot promise you that it is going to be 100% effective every time, as some people just really struggle with NG tube insertions. It is a very uncomfortable and difficult procedure to tolerate for patients, a lot of patients. Try to be patient, try to be calm, try to be reassuring, and again, don't hesitate to stop if you feel that the patient's not tolerating things. For example, if you get to this point here and the patient starts coughing and choking and sputtering, don't pull it out. Stop at that point, give the patient a chance to recover if they can. And if they recover, then you say, are you good? Okay, is the tube down in your lungs, or where do you feel it where it is? And they may indicate that, no, it's in the wrong place. They'll shake their head, whatever. Then at that point, you may want to back it up. Don't have to pull it all the way out. You're going to want to back it up a little bit. You can assess through the mouth. You can have them open their mouth and see if you can see the end of your tube in the back of the mouth, and assess how that's going. Because again, the most difficult piece for them to tolerate is getting through this nasopharyngeal space. You're already there. You don't want to pull out from there if you don't have to. So you can open their mouth, reassess, look at the back of their throat and see if you can see the end of your tube. And again, follow your instructions. Chin to the chest, swallow and grab at it as you go, and try to advance with the swallows. Go, click, swallow, swallow, swallow. Do it in steps, not in one rapid motion, and you're less likely to choke the patient or cause discomfort for your NG tube insertion. And again, if you're unsure how to measure for the NG tube length, so typically it's going to be like 30 centimeters to 40 centimeters for an adult patient. The way to measure is to use the tip of the tube, go to the earlobe, and then from the earlobe, measure down to the sternum or the xiphoid process. And that's going to give you the length of what you need your tube to be. Another pro tip here, so I typically, once I've measured my NG tube, before I do my insertion, I will apply my securement device to the tube at the point that I want it to be, facing towards the patient prior to the insertion. That way, once I get to that point, it's one less step of manipulation that I have to do while the patient is trying to tolerate the procedure. So again, this is not a how-to video. It's more of a tips and tricks on ways to maybe avoid complications. And I hope it's helpful.